NIHCM Foundation is pleased to present results for the 26th Annual Trade Journalism Award, which carries a prize of $15,000. This year's finalists are Ballad Health at Odds with Community Over Controversial Changes, From Modern Healthcare, Doddering Doctors, Hospitals Take a Stab at Weeding Them Out, from MedPage Today. Is private equity ownership of physician practices sustainable? From Modern Healthcare. Dubious Diagnosis, from Science. Why are mothers still passing syphilis to their babies? From the Journal of the American Medical Association. To err is a leadership failure, from Modern Healthcare. U.S. air ambulances, expensive, risky, and regulation averse. From Medscape. Honey, I froze the kids, in print from MIT Technology Review. And IBM Watson, Heal Thyself, from IEEE Spectrum. NIHCM thanks the independent panel of judges for their thoughtful consideration and expertise in selecting this year's winner.
I'm Fred Schulte, a senior correspondent with Kaiser Health News. We chose Caitlin Cox's article, Peripheral Vision, as the winner in the trade publication category. As judges, it's always difficult to pick from what's a pretty distinguished list of finalists, but as journalists, we tend to look for really compelling stories that tell us something that we didn't know, and even better, that make us wish we had written these stories ourselves. Caitlin's story works on both counts. She exposes how some doctors are raking in millions of dollars from Medicare by doing procedures, vascular procedures, in their offices with little in the way of quality standards or any oversight. While many trade publication articles that we look at tend to focus very narrowly on medical economics, her piece puts patients first, and I think it serves as a reminder that patients always should be first whenever anything is happening in healthcare. And now accepting the award is Caitlin Cox.
2 years ago, I first started hearing stories about a doctor's office in Port St. Lucie, Florida, that was worrying physicians in the area. They told me stories of complications, what they viewed as unnecessary procedures, patients being dropped by ambulance at nearby hospitals. It seems like an eternity ago. In today's 2020 world of the COVID-19 pandemic, health and medical journalism is more important than ever. And that's why I'm so grateful to receive the Trade Award from the National Institute of Healthcare Management. I'd like to thank the family of Miriam Derrico for trusting me with the story of their mother. She died at the age of 84 in late 2017 after experiencing a complication during a leg procedure. She went to the hospital with bleeding and ultimately underwent multiple surgeries over the course of 2 months and then passed away. I'd like to thank the physicians, lawyers, and other experts around the country who helped me understand both the small and the big pictures, because as doctors are moving their procedures out of the hospital setting, patients stand to benefit, physicians stand to benefit, so do insurers and hospitals. But there's less oversight, and this is becoming ever more important now that Medicare is reimbursing for coronary procedures, not just procedures in the legs like Ms. Derrico underwent. I'd like to thank, of course, my coworkers in the TCTMD editorial department for just being amazing to work with, a wonderful group of people. I'd like to thank my editor, Shelley Wood, who taught me to ask the hard questions, follow the money, and was extremely patient going through what must have been 5 different versions. And I'd also like to thank my family, who must have gotten very tired of listening to me yammer on for months and months about what probably seemed like a very dry and foreign topic. So, and again, thank you to NIHCM. I'm sure I'll be writing about this topic for many, many more years to come. Right now, I'm thankful.
To learn more about this year's awards, visit the National Institute for Healthcare Management site at www.nichcm.org.